its third part of our free long COVID webinar series. And this is the Matters of the Heart, long-term effects of COVID-19 on the heart. And syempre, aking question, are you ready to learn more about post-COVID problems sa ating pong puso? My name is Nurse Natalie David and I will be your facilitator for this webinar. And this afternoon, we have a lot of people joining us today who are diagnosed with long COVID, probable long COVID patients, and even yung family members po of long COVID patients and health professionals. And from the bottom of our hearts, thank you for spending your Tuesday afternoon with us and magandang hapon po sa ating pong mga participants. And we are glad to have all of you here this afternoon. But before we start, I would like to remind everyone to utilize ang ating pong Zoom question and answer feature for our questions. And selected questions will be answered during our open forum. And use the chat box for your comments. And lastly, we value your feedback. So please po, accomplish the evaluation form within 24 hours after the webinar. And e-certificates will also be provided to Zoom attendees who will stay throughout ang ating pong webinar and accomplish the short evaluation form which will be sent towards the end of the program. Maraming salamat po. And without further ado, I'd like to call on Dr. Jaime Galvestan, the chairman of Health Futures Foundation Incorporated, to give his welcoming remarks. Doc Jimmy. I think we'll check on your audio, Doc Jimmy. The mic is on, but we can still hear you.
Okay. Hello, good afternoon.
There we go, Doc, loud and clear.
Thank you so much, Natalie. A warm and pleasant good afternoon to everyone. Greetings of health and wellness. And of course, isang magandang hapon po sa inyo lahat, lalong-lalo na to all our webinar attendees and to our very special key resource speaker who will be joining us in a few minutes. Health Futures Foundation Incorporated, or HFI, welcomes you to our third part of our long COVID webinar series, Matters of the Heart, long-term effects of COVID-19 on the heart. Thank you for making time to join us this afternoon. The emergence of long COVID in the Philippines has affected Filipinos in developing various types of post-COVID symptoms. Medical experts are continuously conducting studies to look at the long COVID syndrome, and the fight against COVID-19 is not yet over. HFI advocates to spread awareness towards long COVID through conducting informative webinars and establishing long COVID support groups. I would like to extend my utmost gratitude to Dr. Lauren Kay Evangelista, who is graciously sharing her expertise on post-COVID problems of the heart, which will help us understand how COVID-19 affects the heart and the cardiovascular system. Dr. Lauren Kay Evangelista is our specialist from the Philippine General Hospital, University of the Philippines, as well as from De La Salle University and De La Salle Health Sciences Center. We thank God for this privilege to learn together. May all of you be enriched with the knowledge you need to be a blessing to others as well. Good afternoon, mabuhay kayong lahat. Thank you so much.
Thank you so much, Doc Jimmy, for the welcoming speech. And to start the discussion about post COVID circulatory problems, let us all welcome our key resource speaker, Dr. Lauren Kay Evangelista, who will discuss the long term effects of COVID-19 on the heart. And today, we have the pleasure of having Dr. Lauren Kay Evangelista as the key resource speaker for this long COVID webinar series entitled Matters of the Heart, long-term effects of COVID-19 on the heart. And she is an expert on advanced heart failure from the University of the Philippines, Philippine General Hospital, with an extensive experience in the management and the study of cardiac problems post-COVID. Dr. Evangelista completed a recent fellowship training on heart failure in the Division of Cardiology, National University Heart Center in Singapore. Last 2021, she completed her fellowship training in adult cardiology in the University of the Philippines, Philippine General Hospital, and she is a member of the APSC Consensus Panel on Mechanical Circulatory Support of Asia Pacific Society of Cardiology. And Dr. Evangelista is the recent chief of the section of heart failure and cardiomyopathy in the Division of Cardiovascular Medicine, Department of Medicine in the University of the Philippines, PGH, and the head of Medical Intensive Care Unit at the De La Salle University Medical Center. To talk about the long-term effects of COVID-19 on the heart, and to help us understand how COVID-19 affects our heart and the circulatory system, without further ado, let us all welcome Dr. Lauren Kay Evangelista. Doc?
Good afternoon, Dr. Jimmy. Good afternoon, Miss Nat. Thank you very much for inviting me in this webinar. So, pang third webinar na pala natin ito about COVID-19, no? So, it's very nice that there are organizations, there are foundations to conduct these types of webinar because we know COVID is still a big problem in our country, no? So, just what Miss Nat mentioned, I think COVID has a very special part in my training as a doctor. We all remember that the Philippine General Hospital was tagged as the COVID center in 2021. And that the time that we had the lockdown, that was the first day of my chief fellowship. So, lahat ng logistics about COVID-19, pinagtutulungan namin ng mga consultants ko and ng mga co-fellows ko. And just after my fellowship in Philippine General Hospital, I had my fellowship training in Singapore. And during that time, it's still the COVID season. And in Singapore, fortunately, I was able to see patients with COVID and how they manage COVID. We know that in the Philippines, sometimes there is a limitation on the diagnostics that we can do. But thankfully, during the time that I was in Singapore, I was able to witness how COVID-19 affects the heart and how we can manage, how we can do advanced imaging for this patient. So to start our lecture, so we are webinar. So we just take it lightly, no? So not very serious. So hindi dapat active, and we look forward to the participation of our audience through your questions. So we will be going through the long-term effects of COVID-19 on the heart. So we will start off with a case. Mr. AB is a 35-year-old male. He doesn't have any comorbidities. Wala siyang ibang sakit. But he smokes around 10 packs per year. So 10 pack years. And he is an occasional alcoholic beverage drinker. He refused COVID vaccination. And he had severe COVID-19 infection in November 2022. But after the COVID infection, he still experiences easy fatigability, mabilis mapagod, exertional dyspnea. So sasabihin niya, bakit parang ang iksi ng nilalakad ko, ang bilis kong mahingal. And he sometimes feel palpitations, yung parang bakit kinakabog ako? Bakit parang kinakabahan ako? So this is a typical patient with long COVID. No, if you can see November 2022 and it's now around February. So meron pa rin siyang mga symptoms. So we explore what are the causes of the symptoms that Mr. AB is having. So these are the objectives for our session for today. Identify what long COVID is, describe the cardiovascular effects of long COVID, the signs and symptoms, diagnosis, treatment, and what we can do as patients, what we can do as healthcare professionals. So what is long COVID? Long COVID is also called post-acute sequelae of SARS-CoV infection, ang haba, no? Post-acute COVID-19, chronic COVID-19, or post-COVID syndrome. However, the true prevalence is unknown. It's unknown because hindi natin sure kung meron bang mga patients na hindi nila na-recognize that it's because of the COVID infection that the symptoms are causing them, or underreported siya kasi hindi nga natin nare-report, hindi din nare-recognize sometimes ang doctor na baka COVID-19 ang nag-cause ng lahat ng symptoms. But the most common symptom is for this patient and for this condition is persistent fatigue. So we go through the stages of COVID recovery muna, no? So there is a condition called acute COVID. So this is up to 4 weeks following the onset of illness. So after the COVID infection, 4 weeks, that's still part of acute COVID-19. And then there is post-COVID condition, wherein there is a broad range of symptoms that develop after COVID-19, which continue for more than or equal to 2 months, which has an impact on the patient's life and not explained by an alternative diagnosis. No? So ito yung sinasabi nilang not explained by an alternative diagnosis. Kasi halimbawa meron ka naman talagang sakit sa puso, but nagka-COVID ka. May baradong ugat ka sa puso, tapos nagka-COVID ka. Hindi natin masasabing ito ay dahil sa COVID infection. Dahil meron ka pa rin organic or meron kang sakit sa puso na pwedeng nagkakos ng sintomas mo. So ito yung illustration on how COVID-19 affects us. No? So medyo busy yung slide, pasensya na po kayo. But at first, week 1 to week 2, there is a SARS-CoV-2 exposure, and then there is the PCR will turn out positive via nasopharyngeal, nasopharyngeal, and then there will be viral isolation from the respiratory tract. As you can see, week 4 and beyond, after week 4, merong after symptom onset. The most common is fatigue, decline in quality of life, tapos nanghihina yung muscles, and then masakit yung joints. For the pulmonary, hinihingal, may shortness of breath, inuubo. Tapos meron tayong mga pasyente, especially those with severe COVID infection, na nangangailangan ng oxygen kahit nasa bahay na, kahit nakauwi na. In the brain, it can cause sleep disturbances, anxiety and depression, headaches, or sometimes they say brain fog. Parang nabablanko, parang bigla na lang blank. Ganun. But from the heart, symptoms such as palpitations, chest pain can also happen, and thromboembolism. Thromboembolism, yung mga namumuo, nagkakaroon ng blood clot, nagbabara yung mga ugat. And then for the kidneys, we could also have chronic kidney disease. Nasisira yung bato and naglalagas yung buhok, no? As you can see, COVID-19 has a very extensive symptoms and effects. So, ang haba pa, and for just 2021 So 2021, 2022, 2023, we're going to 3 years, and there are still a lot of things that we don't know about COVID. So this is an illustration also of the post-acute sequelae of COVID and the potential mechanisms. Yung sinasabing dahilan kung bakit nagkakaroon ng mga sintomas at ng sakit dahil sa COVID. Immune dysregulation or inflammation, pamamaga, yung sarili nating katawan, yung panlaban natin sa sakit, nasisira, nawawala siya sa sistema. Tapos, merong ding endothelial dysfunction, yung mga ugat natin, yung mga lining, nasisira din. And then, yung kung paano pinaprocess ng katawan natin yung energy na nadidysregulate, no? So, yun yung mga causes kung bakit tayo nagkakaroon ng mga sintomas at epekto ng COVID-19 virus sa ating katawan. So this is a session on cardiovascular effects of long COVID. So just in time, February 28th, last day of February, and we know that February is Heart Month. And trivia lang, it's been 50 years since Heart Month or Heart Month celebration has been signed into law. So every February, talagang dapat meron tayo Heart Week, Heart Month, no? So just a trivia. So cardiovascular effects of long COVID. So paano natin malalaman kung meron tayo ng cardiovascular effects ng COVID? Ito muna yung titingnan natin, yung direktong epekto ng COVID virus during the time na meron tayong COVID-19. Myocarditis, ipagsabihin yung muscle ng puso ay namamaga, inaatake ng COVID-19 virus. maraming pasyente akong nakitang myocarditis nung habang ako ay nagte-training. So, namamaga yung puso, pag namaga ang puso, nahihirapang bumomba. So, stress cardiomyopathy dahil sa infection, ganun din, na-stress yung puso, yung muscle ng puso. So, humihina rin ang kanyang pagpomba. Myocardial infarction, ito yung dahil sa sinabanggit ko kanina, thrombosis, yung mga ugat sa puso ay nagbabara. Heart failure, pumapalya yung puso dahil sa hirap, dahil namamaga ang muscle, hindi makabombang maigi, nahihirapan siyang mag-pump ng dugo na kailangan ng buong katawan natin. And cardiac arrhythmia. Cardiac arrhythmia yung sinasabing nagkakaroon ng irregularities ng tibok ng puso. So this all can happen during the time of the acute COVID infection. So what are the long-term effects? So yung nabanggit kong listahan ng mga sakit, meron yung consequence na mga epekto ng sakit na pwedeng maranasan natin after na ng COVID infection, no, acute COVID infection, no? So bakit natin kailangan malaman yun? Bakit natin kailangan masuri if present ba to sa mga patients who had a COVID-19? It's because the studies have shown that those who have COVID-19 are higher risk of cardiovascular disease, death, and cardiovascular events compared to patients who did not have COVID-19. Kung ikukumpara mo yung isang pasyenteng hindi nagka-COVID-19 sa nagka-COVID-19, dahil sa COVID-19 infection, tumataas yung chance niyang magkaroon ng sakit sa puso. Especially those who are hospitalized and those who had severe infection, they are the ones prone to develop cardiovascular disease compared with those patients who had less severe COVID-19. So that is why it's important to check on the patients if they do have the long-term effects of COVID-19. So what are the signs and symptoms? So the most common is fatigue, pagod, parang pagod na pagod. Dyspnea. I have mentioned earlier that dyspnea is a pulmonary sign of pulmonary symptom of COVID-19 infection, but it can also be a cardiac sign, especially if it's connected to heart failure. So yung patients na mabilis mapagod, hindi makaakyat ng hagdan, hindi makatulog ng nakaupo lang, hindi kayang matulog ng flat. So pwedeng dahil yon sa pumapalyang puso, kaya siya nagkakaroon ng sintomas ng hingal. Chest pain, mabigat yung dibdib, parang may nakadagan or inuubo. The less common are dizziness, pagkahilo, orthostasis, pag tumayo ka bigla kang nahihilo. 'Di ba? Meron tayong mga ganong symptoms na pag tayo mo biglang umiikot yung paligid mo. And then postural tachycardia, pag tayo mo biglang bumibilis yung tibok ng puso mo, bakit bigla kang kinakabahan? And vertigo, yung pagkahilo. So what do we expect during a consult? So ipagsabihin, pag ikaw ay nakaramdam ng sintomas, magpapakonsulta. So pag nagpakonsulta, ano ang tatanungin sa iyo ng doktor? So tatanungin sa iyo ng doktor, kailan ka nag-COVID? Important 'yan. Anong severity ng COVID mo? Na hospital ka ba? Ano ba yung mga sintomas mo? Ano yung mga naging komplikasyon mo during the time that you had the COVID infection? And if possible, bring your hospital and outpatient records to your doctor and your medication list, even the non-COVID medications. No? So we also compare the pre-COVID-19 medical history with the post-COVID medical history. So these are important things that we need to remember when consulting. So during physical examination, what does the doctor do? We check your weight, their height, we check the vital signs, the blood pressure and postural BP. They ask you to stand up, and then we check again the blood pressure, and then we check on the heart rate, kung gaano kabilis yung tibok ng puso. Neck examination, for us heart failure specialists, very important yan kasi we check the pressures of the heart via checking the neck, no, the JVP. And then papakinggan po yung tunog ng puso at tunog ng baga, at titignan kung meron bang sinyales ng pumapalyang puso, kung nagre-retain ka ba ng tubig na mamanas, yung tiyan o kaya yung legs. So how do we diagnose these patients? Unfortunately, there is no widely accepted clinical diagnostic criteria for long COVID. That's why its prevalence is also unknown. But if you have COVID infection, you had COVID infection more than 2 months, and you have symptoms, broad range of symptoms, physical and mental, kasi nga kasama yung brain fog, that clusters that develop during or after COVID-19 infection that cannot be explained by an alternative diagnosis, wala ka namang sakit sa puso, hindi parado yung ugat ng puso mo, then we can consider it as a long COVID syndrome. So what are other laboratory tests that we usually check for this patient? So we check for the complete blood count because sometimes baka naman may anemia, bagsak yung pula ng dugo. So pwede yung mag-cause ng hingal. We check on the kidney function. We check on yung creatinine, BUN. We check on the liver function kasi yun din yung pwedeng nagkukos ng mga sintomas ng hingal, nagmamanas. And then we check the BNP or D-dimer. BNP is the measure of the stress sa heart for patients with heart failure. And the D-dimer is for patients na mayroong thrombosis. So, nagsususpect ng may mga baradong ugat. So, more importantly, if we are considering a cardiovascular effect of cardiovascular syndrome from the long COVID, we do cardiopulmonary testing. So, the most common are the ECG, then we do chest X-ray. So, this is a chest X-ray and this is an ECG. And then we do 2D echocardiography. 2D echocardiography, ultrasound po ng puso. No? Pag in-ultrasound yung puso, titignan natin gaano ang kalakas bumobomba ang puso or meron pang problem sa pag-relax ng puso. So, hindi lang yung pagbomba yung importante po sa amin, pati yung pag-relax or meron ba mga valvula na maluwag na nagkukos ng symptoms on Holter monitoring. So, meron pong pag tinanong ng doctor, pag tinanong nyo po ano yung Holter monitoring po is kinakabit kayo sa ECG for 24 hours or sometimes 48 hours. Sa pamamagitan po nung Holter monitoring, nakikita namin kung meron nagkakaroon ng mga irregular na tibok ng puso or the cardiac arrhythmias, which can cause the symptoms, as I have mentioned earlier. And CT pulmonary angiography, this is a more, advanced diagnostic if we are thinking that merong mga baradong ugat sa baga. So the evaluation and management of complications and persistent symptoms. No, so we expect that mild illness, dun lang sa mga mild symptoms lang, first few weeks after the acute illness, di ba, for more than or equal to 2 months yung tinitingnan natin, magre-resolve din siya. But however, sometimes those who have severe symptoms, they have slower than expected recovery or course, and when they develop new or progressive symptoms, and this should be evaluated promptly. So, halimbawa, nagpo-progress, gumagrabe yung sintomas mo. So, kailangan magkonsulta po agad. So, consultation tips. These are tips for patients when you see doctors. Be honest in answering questions. So, pag tinanong po kayo ng doktor, kailangan honest kayo because consider your doctors or healthcare professionals as your partners in treating your condition. No? Be honest kung may tanong. Kung naguguluhan po kayo sa tanong ng doktor, sabihin niyo po, Doktor, pwede niyo po ba ipaliwanag pa po kasi hindi ko po naiintindihan. So, pwede po magtanong no, bilang pasyente. Hindi naman po doktor lang yung magtatanong. Kailangan nagtatanong po rin kayo. Think of your healthcare providers as your partners. As I have mentioned, nandun tayo para tumulong. Hindi naman po kayo gradean kung ganito. Hindi po grading sheet ang hawak ng mga doktor. Pag nagko-consult po kayo. Bring all your medications, a list of all your medications to your appointment. So, kung meron kang ibang gamot na iniinom, even the yung mga hindi prescribed medications, bring it during your consultation. And if you have old laboratory exam, you bring it with your consult because this will help us in evaluating your condition. Makakatipid din po tayo, baka may bago kang laboratory exams, hindi naman kailangan na ulitin. So we go to the treatment, no? So if you have chest discomfort, pain, tightness, sakit sa dibdib. For persistent or severe discomfort, sometimes we give low non-steroidal anti-inflammatory drugs or yung mga pain relievers. As long as it looks like muscle pain or chest discomfort, not coming from the coronaries or not coming from coronaries, mga ugat po sa puso, or not coming from the muscles na dahil nagkukulang ng oxygen na supply. Minsan po, pag sumisikip yung daanan ng hangin, nagmamanifest din kasi siya na masikip sa dibdib. So we give inhaled bronchodilator, yung mga nebulizer po na may pampaluwag ng daanan ng hangin. But if you have chest pain and you have a history of COVID-19 myocarditis or myocardial injury, you need to seek immediate consult to a cardiologist or your nearby doctor to evaluate po if the cause of your chest pain is myocardial. Ipagsabihin ng gagaling sa puso. Dyspnea or shortness of breath, hingal. So usually nga dahil nga ang COVID-19 po, 'di ba, lagi niyang naapektuhan, lagi inuubo yung mga pasyente, ganun yung sintomas, yung presenting symptoms natin. Nag-i-improve siya slowly. Meron lang mga tao na mas matagal than the usual, the common population, yung pag-improve niya. This may also be due to the fact that COVID-19 also affects the muscles, yung tadyang, yung ribs po natin at yung muscles in between the ribs is very important with our breathing, no, for our pulmonary function. So minsan masyadong mahina pati yung diaphragm, mahina po. So doon ang gagaling yung hingal natin. So mild symptoms, we can do breathing exercises. That could help us in relieving the dyspnea. And for those patients who had moderate to severe dyspnea, if meron po tayong pulse oximeter, less than 92% po yung oxygen saturation na nakikita natin, kailangan po tayong makita ng isang doktor. Orthostasis, ito po yung sinasabi ko kanina na pag tumayo, biglang nahihilo, umiikot yung paligid, no? So this can be explained by sinus tachycardia, bumibilis ang tibok ng puso, dizziness on standing, pagtayo, umiikot ang paligid, no? So initially po, tinitreat natin ito conservatively. So we use compression stockings or we advise the patient na bago tumayo, wag pong biglang tatayo. Halimbawa, nakahiga ka, so upo ka muna, galaw mo muna yung legs mo, galaw mo muna yung arms mo, so yung blood distribution po ay mas maganda at makakaapunta agad sa utak. And then, we can use compression stockings, yung masisikip po na mga stockings, and abdominal binder, kasi yung fluid or blood distribution po, yun nakakatulong para maiwasan natin yung orthostasis. And hydration. Sometimes kasi dehydrated, depleted yung volume, so kailangan pong well-hydrated tayo. Unless merong contraindication sa pag-inom ng maraming tubig, yun po yung mga pumapalya ang puso or yung heart failure patients po. Fatigue, no? So after COVID-19, feeling mo lobat na lobat ka na. So parang itong si sir na nasa picture, wala nang battery, wala nang supply ng energy sa katawan. And this is one of the most common symptom of long COVID, no? This is the one which is most persistent din po. For these patients, for this condition, we do the 4P approach to energy conservation. So energy conservation, ibig sabihin, we utilize the energy properly. So planning for those patients na mabilis mapagod. Planning means organizing your activities in sa whole day. So, kailangan mong i-prioritize. Ano yung mga kailangan mong i-prioritize na activities? Kailangan mong planuhin kung saan magandang i-divert yung energy mo, no? Positioning. There are tasks that we can do sitting. Like, if you want to chop, nag-chop ka ng mga lulutuin mo, rather than standing up, na nag-chop, which will use more energy, then you can conserve your energy by sitting down and chopping while seated, no? Pacing, ibig sabihin, gaano kabilis or gaano kabagal yung galaw mo. Hindi naman po lahat ng bagay kailangan ginagawa natin ng sobrang bilis. So yung pacing ay very important. And prioritizing. If you have limited energy supply, then you divert your energy to those which is more important. So doon natin na-prioritize, we plan, we position ourselves, and then we do pacing. This is a way that we can approach fatigue. So treatment for those with cardiac injury or myocarditis that is related to COVID-19, we should be seen by a doctor. If symptoms are severe, then we should be seen by a cardiologist. No? So patients recovering with cardiac injury with resulting functional limitations should undergo cardiac rehabilitation. So cardiac rehabilitation, as I will be showing you here, it shows here the beneficial effects of exercise training and cardiac rehabilitation. No? Yung cardiac rehabilitation po, it's a program wherein we monitor your heart's response with the activities that we do. We do exercise, we do physical therapy, but we monitor your heart given a program. So may program po yun, minimeasure namin yung response ng heart nyo, your heart rate, and then your symptoms during the activity, and then we progress. And then cardiac rehabilitation doesn't only involve exercise. It also involves encouraging good lifestyle, healthy eating, and wellness po, no? And as you can see in this slide, it has many effects, not only in the heart, but also in the kidneys, pati po sa mga ugat natin, nakakatulong po ang rehabilitation. And specifically for those patients with cardiac conditions, we do cardiac rehabilitation. But the most effective means by which we prevent post-COVID condition is to prevent the COVID infection. No? So prevention is better than cure. So vaccination, masking, social distancing, and hand hygiene, as what I saw from the video din po kanina of HFI, we encourage this to prevent COVID-19. And then COVID-19 prevention would prevent long COVID syndrome. Di ka naman magkakaroon ng long COVID kung hindi ka nagkaroon ng COVID infection. So we come to the recovery. No? So for recovery, 9 months after hospital discharge. So this is the average time that patients with long COVID recover. And for those individuals who were not hospitalized, it usually takes around 4 months for the symptoms to go away. So what else can we do other than the things I have mentioned earlier, you know? So talk to your doctor. So this would entail follow-up checkups, because as we have so hindi pa tapos ang ating laban sa COVID-19, no? Now we are seeing the long-term effects of COVID-19 infection. We are going up or rising above the acute phase, but the long-term side effects of COVID, hindi pa natin nakikita yun lahat. And together, we are discovering more things about COVID. And then get the right amount of physical activity. As I have mentioned, cardiac rehabilitation is very important. And wala akong sinabi dun sa previous slide na pag may long COVID ka, bawal kang kumilos. You just need to pace, and then you need to prioritize your activities for the day. And then you also pay attention to your weight, no? So later I will be mentioning on why weight. And then eliminate harmful substances, refrain from smoking, refrain from drinking, alcoholic beverages, or illicit drug use. So we do, there are patients who are previous athletes, no? Halimbawa, engaged sila sa sports bago yung COVID infection, but they had the COVID infection cardiac effects. So how do we advise patients or those with yung mga sporty na individuals on returning to play? So for 1 month, we do triad testing. I will show you later the table. And then if there are at 3 months and no symptoms, wala nang kailangang i-test. You can do or you can go back to play. And then 1 to 3 months since cardiopulmonary symptoms has resolved and no exercise limitations, then it's reasonable that you encourage your patient to continue exercising without further cardiac evaluation. So this is a graduated return to play protocol, but this should be supervised by a cardiac rehab specialist or a physical therapist or physiotherapist. So there are different grades or different stages, and it shows the activity description, the exercise we allow, the heart rate, maximum heart rate, and then the duration, and then the objective and the monitoring. No, our goal is that for those athletes, for those who are playing sports, intense sports prior to COVID infection, we will be able to return them to their sports after recovery. So lifestyle changes, quit smoking if you're smoking. So Mr. AB should quit smoking, and then maintain your ideal weight or lose weight, and then avoid or limit alcohol and eat heart-healthy diet, and you have your vaccinations, your flu and pneumonia vaccinations. So this is Pinggang Pinoy. This is advocated by the Philippine Heart Association, by the Department of Health, and this shows how our plate should look like when we eat, no? So the grow, balik tayo, 'di ba? Ano, bata pa lang tayo, mga kinder pa lang tayo, tinuturo na sa atin yung grow, glow, go. So protein, fruits and vegetables should actually occupy half of your plate. And then the go should be 1/4, and together with the grow are the protein sources, no? So I also would like to share to you, this is the advocacy of the Philippine Heart Association. It's the 52100, and this is something that we want to share with everyone and want to for everyone to observe now. Meaning 5 servings of fruits and vegetables per day. So kung isipin natin 5, so breakfast, lunch, dinner na yung 3 main meals natin, di ba? Eh, Pilipino tayo, so mahilig tayo sa merienda sa merienda sa umaga at merienda sa hapon. Pero dahil sinabing fruits and vegetables, miss fruits and vegetables, pero baka wag naman yung turon kasi syempre marami yung asukal. Baka sabihin natin fruit naman yun, pero marami yung asukal. So, may din nilagang saging, nilagang kamote, yun yung mga merienda natin. And then less than 2 grams of added salt per day. Usually, what I tell my patients is, kung ano na po yung lasa ng pagkain, yun na po yung kainin, yun na po. Huwag na po tayong magsawsaw, wala na pong additional bagoong, wala na pong additional toyo, wala na pong additional na patis. And then 2 hours maximum screen time. Mahilig tayong mag-cellphone eh. So why do we advocate 2 hours maximum screen time? Ibig sabihin po, we encourage you to go out, no? Go out of your garden, plantita tayo, and then we do activities at home, no? Play with your family or do sports with your family. So we also advise 1 hour exercise per day, at least 1 hour po. If you really can't do 1 hour exercise per day, at least 30 minutes po, no? And then zero smoking, definitely zero smoking, and then zero sugar drinks. Avoid sugar drinks. Mahilig tayo dun eh. Mahirap pigilan, pero sana i-try, no? So, don't lose hope. We are doctors, the nurses, the members of the healthcare system, and from what Dr. Jamie Gavesan mentioned, there are also communities that could help you in coping with the long COVID syndrome. No, so we are here for you and your family. And then you just be honest. Just be honest. Tell your doctors you're very open to what you feel. Do you take your medications? If you're not comfortable with your medications, tell them. It's not hindi kasalanan ng pasyenteng magsabi sa doktor. And that's what I want my patients say. I want my patients to talk to me. Ayoko nung pupunta lang sila sa clinic tapos ako lang yung nagsasalita. Di ba madaldal po kasi ako. So dapat madaldal din yung pasyente ko. So with that, I end my session for today. Thank you very much for inviting me here. Thank you, ma'am.
Thank you so much, Dr. Lauren. Ayan, marami na rin po tayong question and some might be belonging to me and to our participants. But this time, let's proceed to the open forum to everyone who's still with us. I think I've seen our questions being raised. We highly encourage you to send in your questions via the Q&A feature if you're in Zoom. Pero kung kayo naman po ay tuning in on our Facebook Live, we are on Facebook. There is the comment section available for all of your questions. So let's start off with our question, Doktora. One is from our participant without a name. Ang kanyang question, can COVID-19, ayan, ito daw, cause palpitations?
Oh, yes. Okay. So yes, ma'am. It's actually isa siya sa kasama sa COVID-19 post sequelae syndrome, no? Yun po, pwede siya talagang mag-cause ng palpitations. Sometimes it might be due to the myocarditis if meron siyang previous episode na namamaga yung muscle ng puso, or it can cause palpitations because there is what we call the inappropriate sinus tachycardia, no? So yung puso po natin kasi very matalino yun eh. Meron siyang sarili niyang battery. And sometimes yung COVID-19 virus, yung battery ng puso natin yung naaapektuhan niya, kaya siya nagpo-cause ng palpitations. What's important if you're having palpitations is you monitor. If the palpitations cause dizziness, para kang magba-blackout. Parang, alam mo yung sasabihin na lang, lumulutang yung ulo mo, tapos para kang biglang magko-collapse, you need to see your doctor because we need to do investigations like the Holter monitor as what I have said po. Sometimes kasi yung palpitations, tinitingnan namin, merong delikadong palpitations, merong benign, merong chill lang na palpitations, merong delikado na kailangan nating mag-start ng medications. So yes, COVID-19 can cause palpitations po.
Thank you so much, Doktora. What about hypertension?
Yeah. So, ayan, maraming ganyan po eh. So, parang sinasabi nila, after COVID-19, biglang tumataas ang blood pressure. Actually, it's true. There are cases that it could cause hypertension. And sometimes, dahil nagkaroon ng COVID, dahil nagpa-vaccine, biglang na-check ang BP. Doon na-diagnose ng hypertension. Sometimes po kasi, hypertensive talaga, pero hindi nag-check ng blood pressure. But there are really cases that it can cause hypertension. So what we need to look is that, is it an old hypertension, undiagnosed hypertension? Baka naman dati ay hypertensive na siya. Hindi lang nagpapa-check up, kaya lang na-check yung BP nung nagpabakuna. Ayun, mataas pala yung BP. Pero the treatment's still the same. If you have hypertension from COVID-19 infection, or you have undiagnosed hypertension because of your lifestyle, or because it's an essential hypertension, we still give antihypertensive medications po.
Thank you, Doc. No, tama po kayo dyan because majority sa buong mundo were obliged to be seen by a doctor because of the vaccines. No, doon lang nakikita na some of them have hypertension. Kahit pagpahingahin mo before the vaccine, mataas pa rin until magka-work up at ma-diagnose na hypertensive. That's really important also, Doc. Dahil doon nakikita din natin if the person had changes sa health niya right after the COVID infection. Okay, we have another question. Maliban daw po sa X-ray result, are there any way na ma-detect ang COVID infection, long COVID, or ma-detect din po ito sa ECG? Thank you po.
Okay. So for the X-ray, kasi po sa X-ray nakikita natin if there is infection in the lungs, kung merong pneumonia, or nakikita kami abnormal fibrosis, ibig sabihin tumitigas yung baga. Sa ECG po, nakikita natin kung merong injury sa puso, sa muscle ng puso, ng heart, or may nagbabarang ugat, or nagkakaroon ng mga excited beats. So ito po yung mga common na workup din naman kahit sa non-COVID na cardiac conditions. But this can give us an idea na may problema tayong kailangang itingnan lalo, no? So if magkakaroon po ng irregular na heartbeat sa ECG, important po na before then meron kayong record. Kaya po yung sabi ko kanina, bring your old ECG if you have, and then bring your new ECG because we can compare, and then we could attribute if it's really because of the COVID that's causing the palpitations, or dati kasi normal, tas biglang after COVID, biglang abnormal na. So we look into the workup before and after po. So ECG, chest X-ray, 2D echo yung ultrasound ng puso. Yun po yung usually yung basic, and because those are the diagnostics na mas available po, widely available.
Thank you so much, Doktora. We have another question. I've seen it right now sa ating pong Q&A. Her question is, okay, this is actually a good question, no? Ayan, bakit po kahit daw po naka-complete na po ng vaccine, okay, nagpa-positive pa rin po sa RT-PCR? Is this also a sign, Doktora, that the patient is suffering from long COVID?
Actually, for the long COVID, yung yung guidelines ngayon, they don't recommend na mag-RT-PCR pa ulit because sometimes it's the viral fragments that turns out positive, not really it's an acute infection. No, yung viral fragments din po ay nagko-cause ng positive na RT-PCR. But for vaccinated patients, actually, there are different strains kasi. Doon kasi, di ba, nung lumabas yung mga COVID vaccines, merong mga strains, yung strains nag-mutate kasi yung virus eh. So there are mutations na hindi na prevent nung vaccines. But based on studies, those who had COVID vaccines prior to the COVID infection, they had less severe symptoms. That's why we still advocated for vaccination, even though there are patients who turned out positive after the COVID vaccines po. But less severe na yun.
I've seen another question, Doctora. No, this is actually a good question also. For those who have long COVID or had COVID-19, can this also increase the chances of them suffering from stroke or heart attack?
Yes. So those patients who had long COVID, based from studies, they had higher chances of cardiovascular death, non-cardiovascular, all-cause death. Ipag sabihin ko all-cause death, non-cardiovascular stroke, yung cardiovascular death po kasi yung mga atake sa puso, pumapal yung puso. So that's why it's very important that we see these patients, no, and we diagnose these patients kung as compared to a person who did not have any infection, COVID-19 infection, mataas yung chance because of the mechanisms that I have mentioned earlier din po, no, yung thrombosis, inflammation, yun yung nagkakos ng bakit mas mataas yung chance ng magkaroon sila ng cardiovascular death or non-cardiovascular cause of death po.
Thank you so much, Doctora. You have shown a while ago the first case that we had, a person who is walang comorbidities, no comorbidities, although he smokes, but he hasn't had the vaccine. So, Doctora, is this a sign that for those who have not chose to, no, or didn't get the vaccine, should they and then got COVID, is it high time for them to have themselves checked and maybe check their heart and have themselves worked up?
If they are asymptomatic, if pagsabihin wala naman po silang sintomas, then they don't really need to have them checked, no? Kung wala naman silang sintomas, they're actually okay. Kung wala silang vaccination, but they had a COVID infection, thankfully wala silang long COVID symptoms. But if you have the symptoms, you need to be checked. No, so there are people really din po kasi na they don't need they have contraindications to the vaccines, and we understand that there are conditions po talaga na hindi nila matotolerate yung vaccines, but we, the general populations, if you're eligible to have the vaccines, that's one way that we could help them, diba? Yun yung sinasabi nating herd immunity. So it's our responsibility to help those who cannot take in the vaccines, so we protect them by protecting ourselves. Simple.
Thank you, Doc. Nakahinga ako because I'm not sure because my daughter is pretty young pa, no? And when we had COVID in the family, she's asymptomatic. So iniisip namin, she also appeared negative, no, sa test. But that is also a relief, no, for parents who suspects that their kids na hindi pa naka-receive ng vaccine might have gotten COVID. Okay, thank you so much, Doc. Another question we have here. There's so many questions. Thank you so much. Okay, do individuals with heart comorbidities are most likely to develop post-COVID cardiac problems?
Yes. So those patients who had baseline cardiac comorbidities, they are the ones at higher risk to develop cardiac problems post-COVID. That's why, especially for our patients, for my patients, for those patients who have heart failure, we advocate that these patients have vaccines. Vaccines for COVID, vaccines for pneumonia, vaccines for flu, because these patients, those who had baseline cardiac comorbidities, cardiac dysfunction, they are the ones who are at higher risk for cardiovascular mortality and cardiovascular morbidity. So baseline, they have higher risk.
Thank you, Doc. Very concerned participant. Is heart damage caused by COVID-19 permanent, Doc?
Okay, so the myocarditis, the one I explained to you earlier, is the inflammation of the heart muscle because of the virus. Around more than 50% recovers. So it's very important that you follow up with your doctor, especially if you have symptoms or signs of myocarditis and on workup you had myocarditis. More than 50%, the patient, actually I had a patient where he was quite popular patient because he was in the news during my training. So, but before we discharge him, the pumping function of his heart went to normal, back to normal. As long as we catch it early, we give the medications needed. So the effects of myocarditis in the heart, it can resolve. But you need to be seen and monitored by a health professional.
Thank you so much, Doctora. I can see comments from our foreign participants. Thank you so much for attending, but we'll try our best, of course, to keep this discussion, this question and answer, no more understandable for you. Okay, like from our participant here asking if it is possible to have long COVID effect, even if the symptoms just mild and the person is just on his or her late 20s, Doctora.
Yes. So even though that you have mild symptoms, it's still possible to have long COVID effects. But based from what we have mentioned, and we based from studies, those who had mild infection, they are the ones who also have milder symptoms, and their symptoms resolve quickly versus those who had a severe infection, then those who had severe symptoms.
Doc, how do we consider that it's long COVID? How long should we be feeling the symptoms right after the positive COVID infection?
Actually, from the guidelines, from the consensus statement of the American College of Cardiology, it's more than or equal to 2 months. So from the infection. So that's considered as long COVID. However, the terminologies are still revolving because we're still actually in the early part of the long COVID, right? So we're on the chronic phase of the pandemic. It's like on the third year, but we are still in the early phase of the long chronic phase.
Exactly. We're still checking if all of us had the same symptoms, no, if we are suffering from long COVID. Okay, another one, Doctora, we have here a patient who went ablation. He or she is asking, is it safe to get a booster shot?
Okay. So the ablation for everyone is a procedure for the heart where it is for those patients who had arrhythmias for irregularities of heartbeat. So it depends on your other comorbidities, but if you had the ablation for atrial fibrillation not caused by an infection or any other immune system or connective tissue disorder, autoimmune disorder, then actually it's safe to have a booster. But if your arrhythmia is caused by the myocarditis or a COVID vaccine side effect, then you can take the vaccine, but you take another type of booster. So another type, not the same type. If the arrhythmia is true to the myocarditis from a COVID vaccine. But if the cause of the heart cardiac arrhythmia is not really related to COVID or COVID vaccine, then yes, definitely you can get a COVID booster.
So, Doktora, talagang importante, no, na makakapagpa-check up ka so that you'll be able to, no, it's really important to have yourself checked right after a COVID infection if you're suffering from long COVID. So then you will know what booster to get, no?
Yes, yes. Especially there are rare circumstances really that the patients had reaction to the COVID vaccine. But for those patients, the benefit of getting the vaccine outweighs the risk of developing vaccine related side effects.
Thank you, Doctora. You mentioned the myocarditis could be the effect, no? But another question from our participant is myopericarditis can also be an after effect of post-COVID.
Yeah, so I assume this is from a healthcare professional. So myopericarditis is the involvement of the pericardium, yung balot, the wrap of the heart, involving both the myocardium, the muscle, and the pericardium. So yes, it can be by COVID. It can be caused by COVID. So myopericarditis can be due to a COVID-19 infection, and the same as the recovery for myocarditis. We expect that more than 50% or sometimes more than 75% of these patients, once the infection has resolved, the cardiac function goes back to normal.
Thank you, Doc. We have one here. Is it normal to experience daw po breathlessness and easily get tired after COVID infection?
Okay, so breathlessness and dyspnea, shortness of breath, are some of the acute symptoms of COVID. But after COVID infection, you can have breathlessness because of the infection itself. And then if you have more than 2 months after the COVID infection, then we can consider it as a long COVID syndrome. No, so if you have shortness of breath, you easily get tired. It can be part of the um, long COVID symptoms of the from the infection that you had. So these are symptoms like fatigue. That's the bundle of the symptoms that they experience.
Thank you, Doc. Ito naman, Doc, this is a personal question of mine. You have mentioned the unexplained the dizziness, no, upon standing. I have experienced this not too long ago when I had COVID. But uh, meron daw akong iron deficiency anemia, but not that low, no, for me to experience dizziness. Could this be considered as a long COVID symptom?
If your anemia is not really very significant, that could cause your orthostatic hypotension. You also need to check if you have orthostatic hypotension. Then it can be caused by your COVID infection, but we need to make sure that you're not dehydrated or you're very well during the time that you had dizziness. Because sometimes once we hear about the symptoms, baka mamaya, we think that, oh, naku, long COVID to lahat. So those are things that we need to look on. We need to look into very carefully, no? If the symptoms are really attributed to an organic condition, if you have anemia, it can cause dizziness. It can cause lightheadedness. Po. So from the definition of long COVID, kasi it's symptoms that you cannot really find a diagnosis or a cause other than the COVID infection.
Thank you so much, Doctora. Because fatigue is check eh. Right after that, I've been so really tired recently. I mean, compared to being so active before I had COVID, even at the height of the pandemic, and then experiencing fatigue more often now. Well, that one is a tick in the box, and then orthostasis is another one. So it's really, really important, no, to do another annual physical check for this year.
Yes.
Thank you so much, Doctora. One question from our participant: how long is the validity of the 2D echo result? Okay, for example, the result of the 2D echo is unremarkable. But after a few months, our participants is feeling fatigue and palpitations. Is it possible or is it advisable for his or her to take the test again?
Okay, if you're having the palpitations and then you had a recent 2D echo, the 2D echo, we do repeat 2D echo if there is change in clinical status. It means if you had new onset of symptoms, then we can do the 2D echo. But you need to consult because 2D echo cannot determine everything, especially if you're having palpitations. We might need to do an ECG, we might need to do a Holter instead of doing a 2D echo. So it depends on the patient. It's not really the cajon or box diagnostic that we order this for patients with cardiac conditions, long COVID. No? So what we do is we check on your previous 2D echo. We check if there are possible causes of your palpitations or easy fatigability. And then if you have mabilis na tibok or palpitations, then we can do an ECG or a Holter instead of doing a repeat 2D echo. So it depends on the physical examination findings and your symptoms and history.
No. One of our participants is asking, Doctora, have you ever had a patient who developed daw po ITP after COVID infection?
Immune thrombocytopenic purpura after COVID infection. No? So more of the patients that I had during my training was more of the cardiac condition. So I haven't encountered the patients who had ITP after the COVID infection, but it might be handled by the other specialists because when I was training, more of the cardiac patients where I was attending to it. But the ITP, during my fellowship din kasi it was during my cardiology fellowship though. So I have not much experience on ITP after the COVID infection though. We would ask that from our hematology friends.
Thank you, Doc. But this one, I mentioned the kids having COVID. We have a participant who wanted to know this as well. For kids who had COVID, Doctor, have you ever encountered patients or pedia patients who develop heart problems as well?
Yeah. So I trained as an adult cardiologist, but the first patient, it's a very, very memorable patient. Actually, it's a COVID vaccine inpatient. If you look into the news in Singapore, you will see that patient. So the patient waitlifted after getting a vaccine. That's the time when they made the recommendations of not working out after a COVID vaccine. No, so usually the symptoms for pediatric patients is same. So they feel tired, they have sleep fatigability, and it's quite difficult for these patients for kids because kids are very active. So what we can do to help them is we help them pace themselves, or we assist them during their activities, and then we check does he have palpitations, or sometimes kids wouldn't understand the palpitations. It's like your heart is beating fast. So those are things that we can check our patients. But usually for patients, they have a very good immune system and they can recover, same as with the adults. And for kids, they don't have devices. They usually eat well. So they have higher chances of faster recovery than adults who do have vices and other comorbid conditions.
Thank you, Doc. Ayan. Another question. Are there long-term... Okay, what is the incidence of stroke post-COVID?
So post-COVID, actually during COVID infection, due to the risk of thromboembolism, there is a higher risk of stroke. But post-COVID, if your other metabolic panels are checked, you don't have other comorbidities, and you recovered from COVID infection without sequelae, without other symptoms, then your risk is a little bit higher than those who didn't have COVID. But it wouldn't lead to stroke if you also have modified optimally manage your other conditions, like you don't have dyslipidemia, you don't smoke, and then you check on your blood pressures, then your risk of getting stroke from the COVID itself is not really that high.
Thank you, Doctor. I've seen this one just now. Okay. Can a history of COVID-19 aggravate cardiac problems in the future? Or if a person without cardiac problems but exposed to COVID, will they develop cardiac or pulmonary problems? This question is unique when it comes to pulmonary problems seen in the future.
So if you have cardiac conditions, you have higher chances of getting the infection and getting the long COVID. So that's why we advise them. As I have mentioned, no, we advise them to be vaccinated. And then for the patient who had, we know that COVID-19 attacks initially really the lungs. So if you have bronchial asthma, if you have COPD, then you're at higher risk of developing the long COVID syndrome, and you had slower recovery. But if with medications, like if you have asthma, you have bronchodilators, and then this could help you recover from your symptoms. So I myself, I had vaccines and I had COVID twice. So that's very difficult. So during my first COVID, I only had anosmia, but I didn't feel any joint pains. But during my second COVID, so that's when I felt that iba talaga yung paghinga ko. So I thought it was just an asthma attack. But then I felt like this is not my usual asthma. So I treated myself with my inhalers, my usual inhalers, and then a few weeks after the COVID infection, I suddenly, with the help of my medications and exercise, so I was able to regain my function. So that's why COVID-19 is very close to my heart, very personal.
To all of us, Doc, who had the infection talaga, no, it really varies, lalong-lalo na, most especially the symptoms. Right after my COVID infection, I had a very I wanted to say wild, but the changes of my taste, when it comes to salty foods, it became metallic. Taste became metallic. So it really is, or had, very, very close experience to us, more so the patients that we handle. Doc, you mentioned comorbidities. When
Yeah.
the person is suffering from just an allergic rhinitis, are they considered, is that a comorbidity?
No, actually, allergic rhinitis not really, but sometimes you get confused if you have COVID, right? So sometimes because the initial symptom of COVID was stuffy nose, and then you have like colds, and then you had, but I have allergic rhinitis. So should I test for? But allergic rhinitis itself, per se, wouldn't place you at higher risk for developing COVID infection.
Thank you, Doctora. We have another question here. Hyperthyroidism. Doctora, do you have patients who had uh, altered levels that led to hyperthyroidism right after COVID?
Okay. So actually, infection can cause thyroiditis. So that could cause the hyperthyroidism, hyper or hypothyroidism. But for patients who is having palpitations after COVID, then you also need to check if it's because of undiagnosed hyperthyroidism. That's why it's important that before we diagnose patients with long COVID, we need to check other causes of the condition. Like if you're having palpitations, fast heart rate, one cause of this condition is hyperthyroidism. So those are the things that we check before we say that, oh, it's long COVID, because we need to rule out other conditions before we diagnose you with long COVID.
Thank you, Doctora. You mentioned a while ago on your lecture about maintaining weight. Somebody is
Mm.
asking,
Yeah.
what do we need to do about it, Doc?
Maintaining ideal body weight. Maintaining
Ayun.
ideal body weight. Not if from the lecture, it's maintaining your ideal body weight or losing weight, but not maintaining your overweight. So you need to maintain ideal body weight. If you have you have ideal body weight, then maintain your body weight. But if you're overweight, you need to lose weight.
Thank you, Doc. And not the aesthetic weight, because right now,
No.
so many influencers are maintaining their not so ideal weight. No?
Yes.
Thank you, Doktora. Ito naman po, our listener or our viewer is just making sure, because her mom just underwent a bypass operation. She's just
Mm-mm.
making sure that if it's safe for her mom to get a second booster, because she's taking a lot of medications, plus she also had COPD, or has COPD.
Okay. Okay, so for your mom, it's important that you have optimized your mother's condition, because sometimes post bypass patients, they can retain fluid, and then if they're not really on their optimal condition, their heart is not optimized, your lungs is not also optimized. COVID vaccine sometimes can give us flu-like symptoms, right? So we prefer that we give the COVID booster shot if your mom's condition is optimal. So okay siya, functionally well, not having heart failure, then it's safe to get the COVID vaccine if she's in an optimal cardiac condition.
Thanks, Doc. I can see here from our attendee, if not treated earlier, is there a possibility you will develop multiple organ failure, especially the heart, lungs, and the kidneys? Thank you, Doc.
Yes. So there are patients who had myocarditis and then they had heart failure. So if their heart fails, then the kidney can fail, the liver can fail. So it's very important that if you have the symptoms, you need to consult your doctor, your family doctor, your trusted doctors. So have you evaluated, because taking them early would seeing your patients early or consulting your doctors early would also help us to give the right medication or to do the right test early. And then that would prevent the long-term consequences of your condition. Like for myocarditis, if your patient heart can lead to heart failure. Heart failure can then lead to multi-organ failure if not treated appropriately. But for myocarditis, since it's an inflammation caused by a COVID vaccine, the recovery is good if we catch it early and we do the right diagnostics and supportive treatment.
Thank you, Doc. We have from our page. Okay, what about shortness of breath and chest pain? Doctora, this can be confused with anxiety. What about the anxiety attacks? Can this be a symptom of a long COVID symptom?
Okay, so there are patients who had frequent chest pains and dyspnea, and sometimes they had anxiety as well. Because of that, as we have mentioned, there are no tests specific for COVID, long COVID, and there are also mental manifestations of long COVID. So this can happen, but we need to check on, is it really anxiety or what is the cause of the chest pain, because the chest pain might not be due to COVID. You might be having you might have a heart problem na because of the coronaries, especially if you have the risk factors. If you smoke, you have dyslipidemia, high cholesterol levels, and then you have diabetes and other comorbid conditions. So we cannot really attribute everything to COVID unless we rule out other comorbid conditions.
Thank you, Doc. We'll entertain a few more questions asking about the intake of bronchodilator, Doc. Our attendee had COVID twice. How long will I take it? Thank you, po.
So if it's only for the COVID infection, then you could take it as long as you're symptomatic. But if you're having asthma for the bronchodilators, then usually we maintain patients on bronchodilators for asthma, depending on your symptoms. And then there's really no maximum time that you can take in the bronchodilator.
Thank you, Doctora. Our, second to the last question. Okay, when our bodies fight COVID-19, does a cytokine storm can harm the heart?
Okay, so actually there's a pathophysiology of myocarditis. It's really our body reacting to the virus very aggressively. So that's what yung cytokine storm, yun din yung naririnig natin for the diagnosis of patients of having COVID. So it can harm the heart. It can cause the myocarditis, no, the inflammation caused by the COVID-19 infection and the cytokine storm. So that can cause the myocarditis. So yes, it can harm the heart.
Thank you, Doctora. Our last question is coming from our anonymous attendee. For dialysis patient cases po, is there any chance that the infection or the virus can be reduced, Doctora, during hemodialysis treatment daw, most especially if the patient is suffering from long COVID?
Okay, so from long COVID, because for long COVID, you don't have the viral load already. So you have the effects of the long-term effects of COVID into your system. So for dialysis patients, dialysis, it per se, if you're on chronic dialysis and then you had the chronic infection, it wouldn't really lower the viral load. But there were times that they do hemoperfusion. It's not really for the viral load. They're doing hemoperfusion as treatment for the COVID. It's for the inflammatory cells, not for the viral load. We're not reducing the virus by doing the hemoperfusion. It's like a dialysis po. So that was the treatment before. So, but now if you have long COVID, remember, it's not because of you have the virus in yourself. It's because of the effects of the virus, long-term effects of virus in your organ system.
Putting this one last question, should I have myself checked, changing my medication after having COVID? I'm a hypertensive and diabetic patient.
If your medications are controlling your diabetes and hypertension, even post-COVID, actually you don't need to change your medications. But you need to have regular follow-up with your doctor, because you need to have regular monitoring of your blood pressure, and you need to have regular monitoring of your sugar levels. But having COVID, it doesn't require you to change your medications because you had COVID.
Thank you so much, Doctora. We learned a lot from you, and this is also a sign also for those who are listening to us or attended this webinar. And if you have or had COVID or suffering from long COVID symptoms, it is really the best webinar for you, telling you to have yourselves checked, no, even if you don't have COVID infection anymore, but feeling no different right after the infection of it. Thank you so much, Doctora, and for
Thank
the
you,
very
Ma'am
rich and
Nat.
informative discussion. And before you go, I would like to award you a certificate of appreciation on behalf of HFI. Health Futures Foundation Incorporated awards a certificate of appreciation to Dr. Lauren Kay Evangelista for her informative talk in the Matters of the Heart, Long-Term Effects of COVID-19 on the Heart webinar on the 28th of February 2023 via Zoom, given this 28th day of February 2023. And this is signed by HFI President Dr. Cora de Los Angeles Anuevo and HFI Chairman Dr. Jaime Galvestan.
Thank you very much. Thank you very much, doctors. Thank you very much, Miss Nat.
Thank you so much. As we approach the end of today's webinar, HFI would like to thank you, Doc, once again for sharing your valuable insights on the long COVID term effects on COVID-19 on the heart. And of course, our utmost gratitude and appreciation goes to all of our webinar attendees who are really participative. So many questions. And we learned a lot here today and learn new knowledge that is timely and relevant to our objective to achieve holistic health and wellness. And of course, help us improve our future webinars by answering our short evaluation form, and that is flashed on our screen. So it's https bit.ly/HFI MOTH eval. And you can also use your phones to scan the QR code. The link is also sent in the chat box. And please be reminded that the deadline for answering the evaluation form is only until tomorrow, the 1st of March 2023 at 4:30 p.m. only. And again, I would like to remind everyone that we will be sending certificates to Zoom participants who stayed all throughout the webinar and accomplished the evaluation form within 24 hours po after the webinar. And syempre, help us reach more people by following us on our social media platforms. As you can see on your screen, you may visit us on our website, www.healthfuturesfoundation.com. Like and follow our pages on Facebook, facebook.com/healthfutures for timely health tips and for the latest news and updates on HFI's events and projects. Meron din po kami sa facebook.com/alagaka for news and updates on HFI's banner project. That's Alay sa Ginhawa at Kalusugan or Alaga Ka. We are also on Twitter and Instagram at Health Futures, and meron din po kaming YouTube page. It's at Health Futures. And follow our LinkedIn page, linkedin.com/company/Health Futures. And again, thank you for staying until the end of the webinar. And we hope you learned a lot from our speaker. And once again, we sincerely thank you. Lahat po ng tumutok sa atin who attended the webinar even without CPD units. Ayan, again, this has been Nurse Natalie, your facilitator for today's webinar, Matters of the Heart, Long-Term Effects of COVID-19 of the Heart. Have a good day and see you in our future webinars. For our remaining 185 participants and attendees, of course, we are inviting you, for those who are still here, inviting you once again for another free webinar on March 30, and that is a Thursday. So stay tuned on our socials for the updates on the free webinar, another free webinar this coming March 30. Thank you.